How's everyone so far? Good. Okay, so I'm Nadia with 3M PCI. So I am gonna just kind of go through some troubleshooting tips. What floor are you guys on? 4th? 5. Okay, and are y'all day, night? Day? Okay, so you guys see a lot of wind backs then. All right. Okay, so I'm gonna kind of go through some troubleshooting tips. This might be a little bit, too easy for you guys, but I'm just gonna go through it just for some filming purposes. But anyways, if you see me on the floors, again, don't hesitate. I'm just gonna go on the floors and I'm gonna just be checking on patients who are on the wind backs. I'm gonna be poking in into the rooms or through the windows. And I might be like seeing y'all's board to see like what patients on what room and stuff like that because they kind of move. So like I said, I might be going in and out. Just don't hesitate. I'm here. If y'all need anything, don't hesitate to ask any questions too. Okay. I'm going to go through a couple of troubleshooting tips. Like I said, with the wind back, of course, we already know about plugging. All right, plug it in. You got your 2 arrows right there. Just make sure it's in there. If you see this green light, that means that it's on and it's charging. Okay. Right now, vac therapy is on. I'm going to go ahead and pause it because I'm going to go ahead and talk about our canister. Have y'all changed the canister before? Okay. So with the canister, just going to let you guys know really quickly. With the canister, you just go ahead and push this out. Go ahead and see these little flaps. Put that in. Slide it in. It'll be fine. This little gel pack right here at the bottom, just make sure it's at the bottom when you change a canister. Because if it is at the top, you want to kind of try to shake it down or get another canister, but try to shake it down if you can, so that way you don't have to open up another one. But if the gel pack is on the top, it will explode to a gel once any fluid touches it. With that being said, it will cause a blockage or a canister full alarm. So you want to make sure that it's at the bottom. Okay. So again, all you have to do is just go ahead and film it in, push it in. I would kind of wiggle it, see if it's not wiggable, then you're good to go. Okay, so that will lead me to my blockage alarm that we're talking about. So again, I would check anything for your blockage. I would check anything from your coagulation or any blood clots between your canister all the way to your connector, your middle of your connector, and see if there's any blood coagulation. Also, just check to make sure that the clamps are open, no kinks, they're not under a bed, not under a patient, whatnot. If there is any blood clots in between the connector to the canister, change the canister, and then you'll go ahead and check your connection to your patient and any blood clots in between. Let me just move this out of the way. Any between here to your patient and your track, which is your trackpad, then you'll change your trackpad. Have you guys changed a trackpad before? Okay, so I'll let you guys know about that.
I just called one.
Yeah. You just called one. Everybody calls it
Your
here.
hair. It's leaking.
I don't like this noise. Okay, so changing a trackpad is super easy. I mean, you guys are a lot smarter. Y'all are nurses. Y'all know what to do, so don't be scared about it. But okay, so like I said, anything in between here to the trackpad, sometimes there'll be blood clots in here or blood clots underneath the foam. You're going to want to change the trackpad. So with that being said, you guys have trackpads?
Yeah. It's like, I feel like we get in trouble sometimes.
Yeah. So there are trackpads that are going to be either on the floor, if not in SPD. You said you guys are on 5th floor?
I think we have 4, so we have them in our.
Okay.
I think 4. I'm not sure.
I don't think we have those.
Okay. So at 4th floor, because there's more vacs on there, but you guys have a lot of vacs as well. So trackpads. There's only just a trackpad. So these are in SPD and materials. So just make sure that y'all can go ahead and get one. Kind of say this will help with your leaks and your blockage. Okay. So this will be your best bet. Just letting you guys know. All right. So when it comes to changing a trackpad, I'm going to go ahead like we did already. We went in pause therapy. And also just to let you know, if you see how this, a lot of patients move and they move around and stuff like this, your trackpad will get loose. That will also cause a leak. So that's kind of one of your alarms, but also it can be both. So what I'm going to let you guys know is just we'll pause therapy, get some scissors, and then we're going to just go ahead and puncture a hole and just go ahead and peel the trackpad off, okay? So this trackpad right here is just like kind of like a quarter size. Just make sure that it is touching foam. There's lumens in here. They detect negative pressure, and that's how the patient gets the correct negative pressure that they need. So make sure that this hard piece is touching foam. What you want to do is, if it's not, what you want to do is just kind of cut away some of the drape or whatnot. You can kind of cut what you can, okay, and then just go ahead and do that. And then I'm going to go ahead and get another track pad. So I'm going to go ahead and get a track pad, and I'm using some of my expired stuff. Just let you guys know. Get a track pad. What we'll do is we pause therapy, we clink everything. You get a track pad. Does anybody want to try it? You want to try it? Okay. So just to let you guys know, there's a 1 tab and a 2 tab. Okay, so it's 1, 2 blue on a track pad, and then what you want to do is you want to just go ahead and place that track pad. You want to take off the tabs, place that track pad in the middle.
Okay, do we take both tabs off or
Yes.
just the one?
However, well, I would take both. Yes.
I think it's easier to take off.
I think so too.
Rather than trying to take it off after you place it.
Yeah. There you go.
And then you would just kind of center it.
Yes. Go ahead.
And do you want the entire thing to be touching foam or just this central portion?
Just the central portion, or a little bit more than that. But if you can, just try to make it as big as the entire thing.
Just press it.
And then just press firmly.
Fix them.
Okay.
And then the blue tab, you just pull it back.
Is it on this side or is it on the inside?
It's on the outside. Just go ahead. Oh, I'm so sorry. It is on the inside. I'm so sorry. I didn't. And then you just kind of hold it in.
Come off.
That's it.
How would you say this?
Oh, there you go. It's already done.
Oh, okay.
You just pull it off.
Oh, I see. I'm
Oh,
sorry.
that part.
I didn't
Oh,
realize
okay.
what I was doing.
No, that's okay. That's the whole purpose of learning. That way you know how it is.
Okay.
So it's a very thin film, and then what you'll do is you'll just go ahead and connect. And then once you connect, you make sure all your clinks are up, and then you go ahead and turn therapy on. And you have a seal check right here. So this seal check is going to also be your friend when it comes to leaks as well. Okay? So we'll go ahead and make sure that everything is okay. I know this is kind of, we've been replacing it so many times, so it may not have a great seal. But actually, it does have a great seal. Okay, so everything looks like a raisin, which is good. Everything's suctioned down and it looks like a raisin. We're good to go. So that's how you change a track pad. Also, when it is a leak and the leak is around the track pad area, you don't have to patch it up, just change the track pad. I think that's going to be the easiest thing. I know you guys use Tegaderm a lot. Just to let you know, if you guys have KCI drape in it, use the KCI drape. And it's not just because, we want you guys to use it. This doesn't have any pores, and the Tegaderm does. So this is going to be a little bit more stickier and tackier in order for you to do that. We'll go ahead and go through that as well.
That has the 1, 2.
1, 2 blue.
That's how I'm always like, oh God.
Yeah, this one has 2, like 1, 1, 2 blue, and the other one's like 1, 2 blue. So you guys can definitely go ahead and play with it. But I just wanted to let you guys know of how to put it on there. So when you guys do have a leak, also Kevlon's going to be your best friend, pretty much. Besides a trackpad, Kevlon's going to be your best friend. So I would normally go to the seal check button, if y'all know where that's at. If y'all know where the seal check button is on here, okay? Go to the seal check button, see where your leak is at, and I would go ahead and put pressure around it. If it's around your trackpad, then you know you need to change it, okay? And you kind of just press and hold to see if you see that while it's doing the suction. If not, I would go around from your Granufoam or from your foam to the outside of where your drape is at. Press and hold, because sometimes your leak will be around the drape area, okay? So if you do find your leak, also Kevlon, if you go around it, you can kind of hear it whistle, and then that's where your leak, you can hear where your leak is at. So if you get it, you go around and you hear it whistle, then you know where to put your track or your drape. Also, if you're going to put drape against more skin, then go ahead and use a Kevlon to protect it, and then put the drape on it as well. And it's a little bit more tackier, so it'll secure it as well. So if you guys want to practice that on how to just put it on here, just to be on the safe side, when there is a leak, I normally tell everybody to pause therapy, let it puff up to a marshmallow wherever you find your leak, and then if you put it on there, and then at least when it turns on, it will suction down and it will contour to where your leak is at, and it kind of like seals it a lot better. So if you guys want to play with it, y'all are more than welcome to. Of like how to play with y'all's dirty. Y'all can just put it on here if you want.
So we would peel the bag.
It's just like a Band-Aid. So
There's two ones. So what I'll usually do wherever is I'll take the bottom one, peel that off, and that's what I'll stick to the patient.
pull off the two.
And then once that bottom part is stuck to the patient, I'll peel back the second one.
Go ahead and pull the tab.
And really kind of get into the folds. And then you hold the blue tab and peel the two.
Oh, that's what the blue tab is for, to actually hold it down while you peel the two off. Okay.
And then at the end, you just kind of snap that off.
Okay.
Okay. So it's super easy. You could play
Feel
with it.
free to practice.
Yeah. Oh, it's okay. I mean, we'll toss that piece anyway, so it's not a big deal. So that's gonna be how you go ahead and fix a leak with the KCI drape. Like I said, it's best to try to use the KCI drape when you have it instead of the Tegaderm, just because it doesn't have any pores, okay? Also wanted to go and let you guys know, how many hours can a patient be off of therapy? No more than 2 hours, correct? That was a good guess. Yes, no, you're absolutely correct. No more than 2 hours. So anything that is more than 2 hours, the dressing needs to be taken off and removed and tossed, and then go to wet to dry until PT wound care can come in and like do what they need to do and do the dressing change. If you leave the dressing in there soaked more than that, it can cause any bacteria, any infections. It could just lead to infections. So you don't want anything to get dirty. So just to tell you guys, you are busy during the day or nights or whatever, then there is this history tab right here in the middle. And if you go to bottom right, there is a history button. Oops, I'm so sorry. There is a history button, alarm history, and this will tell you every single alarm that you see that's going on, okay? So you guys are just like maybe pausing it because it's loud and it's annoying. You gotta go fix other patients, you gotta take care of other emergencies and stuff like that. Then you come back, you're like, shoot, I don't know how long that's been or what alarm it was. Go to that history tab again. History, alarm history, and you see every single alarm, okay? No more than 2 hours, then you change the dressing.
I wanted to comment really
Go
quick.
ahead,
Sorry.
of course.
Sometimes if you see that it's less than 2 hours and you can't troubleshoot, you can't find the leak, and you call us and we're like, oh my gosh, we can't get there, can you get it to wall section? Do you guys are familiar with how to do that?
No.
Okay. So you just get a,
I'm just kidding.
Oh, yeah.
it's not really something that,
It's fine.
it's not the ideal negative pressure.
Okay.
The machine is the gold standard, but in emergencies where we really don't want to stop the negative pressure for the particular patient, you just hook them up to the canister, and then you have to cut this and feed it in.
Yeah, and I've been like, oh my god, and I've had to like my fiber in.
I
I've
kind
had
of
some rough nights.
cut it on an angle, and then it can kind of fit in, but you'll still have to secure it with tape. In that situation, you want to let the surgeon know that you did that, the doctor know that you did that, and make sure we know as well, so we can fix it as soon as we can get to it.
And do you just turn it to high suction, like as high as a
125.
125,
Yeah,
just like
good
the machine?
question.
Any questions regarding any of the troubleshooting tips? Any leak questions? Any other issues that y'all know of that we can try to answer?
Any questions about airflow? How to change out the?
Can we do that?
Absolutely.
Okay.
If
Yeah,
you
show
get
us
the
how to do
if you get the solution bag empty alarm, absolutely.
Okay.
You can either use a normal saline bottle, a normal saline bag, or a Bosch.
Is this on the bar or is this in the...
This is not. This
Okay,
is
so it's
something
also
only that
part-
we have.
Okay.
This is not even an SBD. So you'll need to call us. If we didn't leave one at the bedside, you'll need to call us for one. If we're not there, if we've left already for the day, or we're not there yet, or whatever, normal saline is fine. So you just, you'll have to take off the old bottle and then just puncture the new bottle, and then make sure this little blue tab is open. And you'll know if you forgot to open it because the bottle
Can you
will.
take this cap off, though, or did you stab it?
You can stab through, yeah,
Alright.
and then just
Okay, yeah.
I guess you can do both. I usually just go through it.
Okay.
Oh yeah, you have to. Yeah.
I'm sorry, what did you say about the blue cap being?
You just want to make sure this is open, just to let the air out. Otherwise, the bottle will just kind of suck together. And then just restart therapy.
And that saline bottle, is that something you would get from SPD? It's got a special cap on it, right? So you can stab it.
No, these are in the supply closet. If you have to switch, if they're already on saline, where is that little?
Cap?
Here. You'll have to save this from the old bottle.
Okay.
This comes with the Veralink, so you'll just have to take that off. To shut that on. Yeah.
You
Where do
will
we
have
get the caps? If we want
So we have to get a whole new Veralink kit. So sometimes it's easier just to use the saline bags because you don't have to worry about this component. You know what I mean? Yeah.
Yeah, and you can just put.
If it has a bottle already, just make sure you save the cap.
Usually we'll try to write on here, do not throw away.
Yeah. And then if you do Veriflow, if you are doing, or if the patient has Veriflow, you are going to change the canister a little bit more often, which is normal, just to kind of give you a heads up on that part.
Is
Any
there a
questions?
setting where it's sucking a certain amount every hour? or-
Yes, we all have that preset. Let's see, it'll be therapy settings. Where you can kind of go in and see this is where we have the negative pressure. And then this will tell you, we'll preset this, you know, so we can set based on the size of the wound and the tissue
What's the
quality.
normal setting?
It's usually, like if it's a toe wound, maybe or a foot, we'll put maybe 8 to 10 mils. If it's a big sacral wound, maybe we'll put 50. And it's typically a 10-minute soak every 2.5 hours.
So when we put a new bottle, we don't have to mess with anything, like, it's
No.
just gonna suck it up.
Yeah, you'll pause therapy before you change the bottle, and then you'll just have to restart therapy. But you won't have to mess with any of the settings.
None of the settings. You'll be okay. Also you guys do know this doesn't go home with the patient, doesn't leave with the patient. It is literally like $30,000. If you see any of these that are not being used, put them on the 4th floor soiled utility closet across from the service elevators, and just put them in there because our service center driver does come and does pickups every day. Okay. Are you guys familiar with Provena? Have y'all seen it?
I've seen it in the chart when they put it in the I don't.
Pay attention.
I
Like, not pay attention, but it's
Yeah,
just don't.
I've
Okay,
seen
it's
it,
like
yeah.
Okay,
That's
so
the one
if,
that goes home with them, right?
correct.
Disposable.
Yeah, these are disposable. These are for closed incisions. If you see a purple dressing, it's going to be Provena. I just always say P for purple, P for Provena, purple dressing. These are for absolutely closed incisions, like sutures and all of that. They put that on there. It stays on them for 7 to 14 days. Provena will have a 14 on it if it's 14 days. If it's 7, it's just going to be like this. Each circle is lit up, and after every 24 hours, one will turn off. Troubleshooting a Provena is going to be just like troubleshooting a wound vac with the drape, the trackpad, and all that good stuff. This is a little bit older model, but they do have the same trackpad as we have now. So if for any reason you need to go ahead and replace the trackpad, you can do that with it. The X right here is going to be for blockage. The Y right here is going to be for a leak. Of course, you have your battery, and then you have your silence alarm right here. To turn this off, you just press and hold for about 6 seconds. I strongly suggest if a patient is on Provena and they're staying overnight, to go ahead and put them on a KCI wound vac, and there is a Provena setting on here that's already set. Let me see. It's going to be for the Provena setting, and like I said, I would just connect it and put them on there. When they do go home, they toss this as well with everything else, but they do get that taken off at the clinic. If they are going home, just make sure you have 2 parts of the charger. It's just like your cell phone. These only last like about 8 hours. as far as charging, and then they'll turn off. We don't want the wound to get infected or get dehisced after doing the surgery, but make sure 2 parts of the chargers going home with them. If they do not have that, also just try to find out where they come from. Majority of the times in surgery, just ask surgery to go ahead and look for the cord for that particular patient. Any questions regarding the Provinas?
Are the cords interchangeable? I know that, like, I have sent people home and wound care comes and changes it out for home wear. Is it, are the connections interchangeable? Like, if they came in with one, we could just hook it up to the electrical?
Yes.
And same with the home vac.
Correct.
The little vacs. I didn't bring one today.
Yeah, I didn't. Mine's at the sharp center. So, yeah, it's the Provinas. The Provinas are like this one. Like I said, is an older model, but the new Provinas that you guys have here, they are going to be the same connection, all compatible with it, and all you have to do is just connect it and stuff like that. Any questions? Okay.
I feel much better about draping now.
I know it's
I was always
it's
like
easy.
saying, like, I don't know what